Molly sent a message about RSV. Let's give her a call back, find out what she wants to know.
Hello?
Is this Molly?
Who's this?
This is Nurse Stefan. I'm calling because you sent me a message about RSV.
Yeah, hi.
So you're clearly sick?
Yeah, I am sick, and I messaged you because I was kind of freaking out. I just read this article from like today.com, and about this little baby who was hospitalized and super duper sick, and it said something about it was just like cold-like symptoms for adults. Clearly, I have this cold, and so.
So you're worried?
I am worried. Yeah, I have a 14-month-old.
I don't know how familiar you are with RSV, but RSV stands for respiratory syncytial virus, okay?
I can figure out how you say it.
Yeah, you're right. It's everywhere and just about everyone gets it, okay? Including you, me, your kids, everyone, okay? Let's just nip that in the bud right now. In fact, it's pretty safe to say that everyone's gotten RSV by the time they're like 2-3 years old. Every year during this season, like October to May, it usually gets the worst right around the end of January, beginning of February. It's all over the place. Everyone's just walking around with RSV.
If like a bunch of people are walking around with it, does that mean it's not like that to you?
No. As you said, in adults, it can just look like cold-like symptoms, but that's because, we can compensate for it. Older kids, grown adults, but you're also right to be concerned about your 14-month-old. When it comes to the little ones and the elderly, their bodies can't quite handle it as well as ours can. So now it may or may not be dangerous, and I know that's a frustrating answer to hear, but our bodies aren't cut and dry, and that's why we have brains to be able to resource like you're doing now in order to determine whether or not it is or is not dangerous, okay? And we're going to talk about that.
Okay.
So first, let's remember that RSV is just the name of the virus, okay? The respiratory syncytial virus. It's not the actual disease process that's happening. It's what's causing it. The virus that's usually causing bronchiolitis and in some cases pneumonia. Okay, so you've heard of bronchitis before, right?
Yeah, it's just got over it.
Okay, yeah, so, well, what's happening with your sister is her upper airways are getting inflamed, okay? And that can be acute, like an attack, or like ongoing inflammation, which we would call chronic bronchitis.
Okay.
Now, bronchiolitis is what we usually see in children, and it's inflammation of the lower part of the respiratory tract, in an area of the lungs called the bronchioles. Because the job of the bronchioles is to help move air in and out of the lungs. They get all swollen and mucousy, and it makes it harder to pass air from, the outside world into your lungs, or what we commonly call breathing, right? But nonetheless, RSV is the culprit that's causing the bronchiolitis, and so that's what we have to treat. So I'm going to test your knowledge real quick. What antibiotic do we use to treat RSV?
I don't think you do because it's a virus, right?
Boom! Ding, ding, ding. Round of applause. Well done. Someone's paying attention. Now, if there was some sort of bacterial component, like bacterial pneumonia or something like that, then we would treat that with an antibiotic. But a virus on its own, no antibiotic. Now, most of the time, RSV will cause bronchiolitis that'll come and go on its own. So your kid might not want to eat, might have cold-like symptoms, a runny, stuffy nose, a dry cough, a low-grade fever, that kind of thing. So your best resource whenever you're worried about your kid being sick is your pediatrician or other healthcare provider. Call them and talk to them, whether it's them or the nurse triage line, whatever it is. Tell them what's going on, okay, and act according to the guidance of your healthcare provider. That being said, a lot of times this is what they'll tell you. They'll tell you to not worry. Make sure your kid's, drinking lots of fluids. Use a humidifier to help moisten the air so the airways can stay moistened. Saline drops with one of those bulb suctions. They might have you manage the fever with Motrin or Tylenol, depending on their age. Get that recommendation from your provider. But never aspirin, okay? You know why?
Not really. I know that it does not to keep it together.
Yeah, it does, yeah. So it's Rye syndrome, and it's a whole nother topic we'll talk about in another video. But just know that you don't want to give aspirin to anyone under the age of 18. They're probably going to give you some of that advice, but they're really going to tell you to keep an eye on your child getting worse, okay? We're talking about wheezing with really bad cough, having a real hard time eating and drinking, really fast-paced breathing, rapid breathing. Also, babies do this thing called apneic breathing, which you've heard of sleep apnea before, I'm sure.
Yeah, sounds like breathing machine.
Yes, exactly. So apnea means the absence of breath, right? So basically, what babies will do is they'll start breathing really fast and then all of a sudden take a pause for anywhere up to 20 seconds. So it would sound something like
oh my gosh.
That was 10 seconds, roughly, okay? So that's how scary it is, okay? Babies like to scare the bejesus out of you. They also do this thing called retractions, which looks like the skin around their rib cage is getting sucked inside every time they take a breath, and you'll be able to visibly see that. Okay, but any grunting, or if they're starting to show signs of, cyanosis, paleness, turning blue, anything like that, don't mess around, immediately call an ambulance, okay?
Scary.
Now, since RSV is a virus, and as you correctly said, we don't use antibiotics to treat viruses, we use supportive therapy, which is usually like supplemental oxygen, which can range anywhere from little tiny nasal prongs we'll put in their nose, just to actual intubation, where we put a tube down their trachea and we use mechanical ventilation to breathe for them. Which can be a very scary sight for everyone, but it is to ensure that the child's getting enough oxygen to their brain and the rest of their body to adequately grow and sustain life, okay? But remember, this is only a temporary measure, okay? Until the virus clears, okay? Your kid improves and they can breathe on their own again. Aside from that, we usually give fluids through an IV because even if we're not mechanically breathing for them, they have a low likelihood of being able to keep stuff down, being able to eat on their own if they're breathing at such a rapid rate. So most healthy kids, like I said, are going to get over bronchiolitis caused by the RSV in a few days. But if it's a real young kiddo, say a premature baby or something, or if they have any sort of pre-existing like lung or heart issues, the recovery process is going to be prolonged. Right? So the question is, how do we not get RSV, okay? And the answer is it's probably not going to happen. But what we can do is try and stop the spread of RSV as best as possible. And number one is and always will be washing your hands, especially if you're around a lot of sick people, okay? Washing your hands is a must because the further you go in life, the more hard surfaces you're touching and the more likely you are to spread your germs around. You can definitely use hand sanitizer if there's no sink handy, but make sure you do it thoroughly, and then when you get to a sink, wash your hands thoroughly. Now, do you smoke?
Oh, not at all. It doesn't sound like it right now, but I don't.
Good. Okay. Do not smoke around children, okay? Please, just don't do it. It's not good for you. It's not good for them. And this one may seem like a no-brainer, but limit your contact around sick people, okay? Including kids. I'm not saying quarantine them, but limit your contact with them, okay? It's not forever. It's just until you or they are getting better. And that doesn't mean you can't breastfeed. It's actually encouraged that you do because it provides antibodies to the child. However, check with the CDC because they have all sorts of recommendations around that. Now, the widely recommended annual flu shot can be given to anyone over 6 months because the flu, just like RSV, can be life-threatening in a very real way. They may meet criteria for receiving a medication called palivizumab, okay, which helps protect against severe cases of RSV. Again, these are your choices, but remember that the choices that we make in protecting against these life-threatening illnesses are not only for ourselves and our loved ones, but for our society as a whole, right?
Oh, definitely, yeah.
There you have it, Molly. RSV, okay? Respiratory syncytial virus, causes bronchiolitis, or the inflammation of the little bronchioles in the lungs. It can be, not that big of a deal to a very dangerously big deal. So now you know what we look for, when and how to go about getting help for it, okay? Do you feel better? Of course you don't. Well, I hope you do, though.
Thank you.
Any other questions?
No, I think you cleared it up. Thank you so much.
All right. Let's hope that laryngitis clears up. I'll talk to you later.